Today, we're going to talk about suck, swallow, breathe, synchrony. What does that even mean? I know, another crazy thing that I'm talking about. Go ahead and watch till the end, and I'll give you some of the resources that are going to help you learn more about what you can do to help your infant survive and thrive. First, we're going to talk about what is suck, swallow, breathe. Why do you even care about suck, swallow, breathe? And how can you help your infant grow, develop beautiful facial features, and thrive throughout their life? Have you ever observed when you take a sip of water or coffee, you swallow this suck, swallow, breathe pattern? If you don't know what it is, probably not. It's your ability to eat and breathe at the same time. Not everyone can do it. It's a rhythmical, coordinated pattern, also called SSB, suck, swallow, breathe, synchrony, because you do it in synchrony. It's the first developmental pattern we learn in an infant. Even before birth, we do it. And then when we are born, we latch on our mother or we start drinking a bottle, we have this, hopefully. Whether you listen to your child eat, whether you're bottle feeding or breastfeeding, if you hear noises, it's probably not rhythmical. You shouldn't hear a noise coming out of your infant or have facial grimace when you're feeding them. So you're going to want to listen and look at their face for cues, whether or not they have this coordinated suck, swallow, breathe. When children are born prematurely, they don't necessarily have this skill. So using a pacifier, which is referred to as non-nutritive sucking, between meals can help them build this coordination. So sometimes a pacifier is good for you, even though it gets a bad rep. Therapists will also work with a pacifier in the hospital with infants, so that way they're ready to feed if they're having issues. Not all moms can latch on the first try. They might have a tongue tie or a lip tie, or there might be another issue that's happening. So coordination with the infant and feeding is going to be really important. If you don't nurse, you need to find a bottle that fits your infant's mouth, especially if they're struggling with any of these feeding issues. I would look with tethered tissues first, and then I would look at your infant's ability to bottle feed or breastfeed safely and competently. This is not routinely a concern that a majority of new mothers have. They don't think about, when my baby's born, are they going to be able to breathe and eat and suck and swallow at the same time? It's not something I was thinking about. It's something we learn to do instinctively, right? But unfortunately, 25 to 40% of normal developing infants and 80% of underdeveloped infants or premature infants have this problem, and they experience oral feeding difficulties. So it's more common than you would think. It's something that you want to know as a new mom, or if you're thinking about having kids, or if you've had difficulty with your kids, this might explain why. If a baby has difficulty feeding or it's painful for the mother when a baby is born, the first thing I would look for is a lip or tongue tie to see if that's the cause. That's something that's easily treated right after birth. The first few hours to the first few days, weeks, months, whatever. I didn't know that stuff when I had my daughter. There's so much involved with this, and that's why there's so many people in the field and so many books that I'm going to share with you. Baby Led Weaning is a really good book to learn about. So when your baby is born, I would start reading this book. It's one that I recommend, and it's an essential guide for me to learn about this stuff. Diane Barr is a speech language pathologist, and her book has so much information in there, what my mother never told me or her mother never told her that. So your baby doesn't come with instructions, right? How do we latch? How should a bottle fit the mouth? What nipple size do you need? How big should the opening be to control the flow of liquid for your baby? How do you hold the baby to keep from getting fluid in their ears and creating airway problems or gas problems or them needing tubes in their ears? If you're a new mom, you're thinking about having children, it's things that we don't really talk about until they become a problem. So Diane Barr's book is great for that. And then Baby Led Weaning is good for after that. So it's good to know these things before they become a problem, so you know what your plan B might be if you have these problems. You want to recognize that safe and efficient nutritive sucking does not relate solely to sucking. So nutritive means that they need the food to gain weight, to thrive, to survive. Non-nutritive means suckings that are finger, their thumb, the pacifier, whatever they're going to put in their mouth. That's how babies view the world when they're born, is by putting things in their mouth, that oral sensory stimulation. So it's important that they have this synchronous suck, swallow, breathe, and esophageal function in order to swallow. A lot of the stuff that your baby does helps develop your airway, the roof of your mouth, your teeth. All of these things need to function together. It's called the nutritive sucking pathway. And all of this is responsible for the safe transport of milk, a bolus that you make with your tongue, like a bowl. So when you swallow, it pushes the food through their esophagus into their stomach. It's important what your tongue does. Does it stay in the proper position? It's going to affect the craniofacial development, your airway, your breathing, your future facial and jaw development? Do you want them to have beautiful faces, or do you want them to have a retrognathic open mouth breathing? So suck, swallow, breathe is a pattern that coordinates just what it says: suck, swallow, breathe. It helps us breathe and eat without choking. The suck, swallow, breathe synchrony allows them to breathe without choking, interact with their environment, explore their environment, which is what babies do. They explore with their mouth and their hands when they're babies. And so putting stuff in their mouth is normal. But when they start eating, they're often going to explore what's happening with their mouth besides just feeding. So the primary component is oral motor mechanism, and it's critical for many areas of development, including speech, language development, posture, motor development, self-regulation, attention, like attention deficit disorder, because if they're not breathing correctly, they're not getting enough oxygen, it can affect their psychosocial development. It can affect their feeding and eating behaviors, which then can affect their behavior. It can affect their hand-eye coordination. So do you see how important the suck, swallow, breathe can affect our children? Most of us do this unknowingly in our everyday life, and we don't think about it. For babies, sometimes they do have issues. You can see some might take water, take a breath, hold their breath. They don't know why that's happening. So that's why it's important to look at in our children. When adults are lifting things or working out, sometimes they hold their breath. There are things that we do that we're so unaware of. And look at the suck, swallow, breathe pattern, because it can strengthen and refine and facilitate the oral development process. So whether you're sucking nutritive, it involves transporting milk and food into your mouth, into the stomach. When it's compromised, it's an issue. When you suck and swallow, you close off the nasal passages. You put your tongue up. It prevents stuff from going up your nose. It goes down. Your lips are closed with no air penetrating when you suck and swallow. When you're nursing, or when you're bottle feeding, or even when you're just sucking, even to get your saliva going down if you're not using it nutritively, how you swallow is going to be important. The compression of your tongue against your hard palate, especially when you're nursing, gets the milk out of the nipple, whether it's a bottle or your breast. Even when you're just sucking, swallowing, having your tongue up is going to be really important to getting that go down without air. The normal swallowing process is divided into an oral phase, a pharyngeal phase, and esophageal phase, kind of how it goes down, the step down. It's based on the knowledge that's acquired from observing developmental feeding in preterm infants. We've learned that these components through all of these phases as they mature. So if we consider the nutritive sucking, it occurs at 1 suck per second. It's expected that they make a bolus of their tongue every second. They're going to be able to clear the oropharynx and esophagus before the next bolus arrives. There's a lot going on with the function of the swallow and the tongue when it comes to feeding. So I want to emphasize the importance of how delayed actions of these steps might lead to infant feeding disruption and problems with gas or ear problems. We need to transport our food and make that a nice, easy sequence. It can affect motor functions. When you have a poor bolus formation, liquid can drain from the pharynx, and it might not trigger the correct swallow, which then leads to improper timing with the suck, swallow, breathe. So the epiglottis might not open and close properly, and then they can choke. So that's the ultimate thing that can happen. That liquid can linger in the sinuses, and it creates an issue of maybe aspiration, swallowing air, choking, more gas for your infant. So if your baby is really gassy, you might want to watch how they're breathing. My daughter was really gassy. It may be the suck, swallow, breathe. So that's where a lactation consultant is going to be good. I don't work with babies with feeding like that, but I do know lactation consultants and feeding specialists that can help. So it's going to be important for looking at these things because it's the common pathway of safe and proper oxygen and carbon dioxide exchange, breathing through your nose. Infants cannot breathe through their mouth until they're 3 months old. So they need to be able to breathe through their nose, have their nose cleared in order to get the nitric oxide CO2 exchange and have that proper suck, swallow, breathe in order for their brain to grow and develop properly. That first 1,000 days is really important. That suck, swallow, breathe to getting the correct amount of oxygen to their brain. They're going to be growing and developing structure of how their face grows, how their palate grows. How we feed them is really more important than we ever knew before. So I feel if there's a problem with infant feeding, the one thing you can do is listen, really listen to see, is it rhythmical? Is your baby making noises? Are they making facial grimaces? What's happening with their nose and their mouth? Do they need to take pauses to breathe? proper function enhances oral feeding. These coordinated activities will ultimately lead to safe and effective feeding, breathing, and development of your baby's face and airway. As they grow and get teeth, they're going to need to chew, swallow, and breathe. This is going to be important to observe as they grow and you're feeding them different foods. When your kids get baby teeth and they don't have spaces between them, my daughter didn't. This is what hers look like. You need to see the spaces between them. If they look like she does, that should be a red flag that your baby or your child has some airway issues. They probably have them already if they have all their teeth in and there's no spaces between them. So some of the basic exercises you can do with kids when they start to get older too with oral motor skills is blow bubbles. That's one thing that can help them blow out. So that's an exercise that you can do. And it's going to be really important that you brush your child's teeth twice a day. Brush their tongue, get the milk off their tongue, even before they have teeth. Also to help desensitize them, using a soft brush will help way before they get teeth to get them used to when they do have teeth and you need to get in there and brush them. I know my daughter would spit out milk. She would spit out toothpaste. She would spit out food. I didn't know she had those sensory issues. And then I even tried bottle feeding and she couldn't handle any formula. I nursed and pumped until she could take milk. She had issues from the beginning with any types of formula. It wasn't until later that I understood the textures, the sensory, why she was having some of these feeding issues and why we had problems. So baby-led weaning is going to be really important. I knew nothing about that back then. So that's why I talk about this stuff now. I just thought she was being difficult as she grew. My child wasn't going to suck her thumb, spit toothpaste out at me. She was going to brush her teeth twice a day. Kids don't come with a handbook. And didn't matter what I did for a living. My child tested those things. So there are different exercises that you can do to help them. And that's where myofunctional therapy comes in, physical therapy for the mouth. Are they putting things in their mouth? Are you giving them things to help them chew? The carrots, celery. I know when my daughter was little, it was like, no, don't give her that stuff. Give her softer foods because we don't want them to choke. But now what I've learned for craniofacial development, you want them to chew those things. Back before the agricultural revolution, his mom would chew up their meat and then give it to their kids. I know it sounds kind of gross, but we had harder foods. We used our jaws differently. We didn't have these softer processed foods. And that's just what they did back then. If they're 12 months or older, they can work on drinking from a cup, from an open cup. They don't have to be a straw. You don't have to worry about spilling. They can learn how to use that suck, swallow, breathe. And again, that's where a feeding therapist or myofunctional therapist can come in if your kid gets older and you're having issues. So at least once a day, whether it's breakfast time, after school, dinner, whatever time's convenient with you, give them an open cup that they can practice with. Give them something that works those muscles. Chewing. It's really great to start looking at these things when your kids are younger. I know we're really busy. We're not talking about this stuff. All of these things are happening in our lives, but at least once a day, if you can work with these feeding issues, drinking out of a cup or watching how they're eating, even self-feeding, giving them a spoon and a fork, watch how they're chewing and swallowing as they grow, then red flags. I talked about my niece not being able to chew, swallow, and breathe at the same time. None of us realized she was having that problem. Then my sister was always saying, close your mouth, chew with your mouth closed. She was smacking her food. It wasn't until I became a myofunctional therapist that I realized she was chewing that way because she couldn't breathe. She couldn't chew, breathe, and swallow. They were separate. She couldn't get that coordination in, right? And so that's something that I wish I would have known then. I feel terrible. I feel gypped that I wasn't taught this in school. It was out there. It was available. It's just not something that was taught in dental school. It's still not taught in a lot of schools. Even in orthodontic schools, they have you wait, and they have you wait because that's what they were taught. So getting a better understanding of all of this stuff, of oral feeding, identifying airway issues, you can identify these things sooner so we can facilitate the development, give you evidence-based tools of intervention that can enhance the development of these skills for our kids. There are people out there that can help you. And now I'm in a wonderful community of people that I know that are doing this stuff, that are writing books about it. They're speaking on it. Hopefully you'll be hearing them. I did a podcast with Dr. Shireen Lim and Breathe, Sleep, Thrive. Learning this information, coordinating the suck, swallow, breathe, feeding your kids safely and effectively are going to be really important to their growth and development. With better understanding of the process of this function and the management of feeding, we can improve what's happening with our children. We can have better expectations of what our kids should be able to achieve the functional maturity levels of your infants and your children. So I hope you can see the bigger picture of how all of this is put together. How we feed our kids is going to determine how they grow, how they develop, how they breathe. It all starts with the mouth, how you breathe. Sucking, swallowing, breathing is going to affect how much oxygen they get to the brain from the start of their life, how much oxygen they get if you're a mouth breather when they're in the womb, right? So we want to follow their kids as they grow and develop. I'm still unsure why we don't talk about this more. We start and end our life with a breath. It doesn't make sense to me that we don't pay attention to how our children breathe. How we breathe will determine how healthy we truly are. Take a moment, breathe that in. How we breathe affects how healthy we truly are. How much oxygen we get, how we sleep. So if you have any questions, if a family member has any of these issues and you have questions, click the link below. You can schedule a call with me. If you know someone who's struggling with, please reach out to me. Schedule a call. I'm here to help. If you don't want to schedule a call, keep watching these videos. You can follow me on Facebook. There's a link below. I have things in the Facebook group that I don't share anywhere else. Thank you for wanting to know more. Thank you for following me. You can see I'm very passionate about all of this stuff. And I just want more parents to have this information because I didn't. We can help our kiddos not be put on medications, maybe not have to wear braces when they get older. If we can start to look at this stuff when our kids are little or even before we have kids, we can help them. As always, thanks for watching. Share with someone if you think they can benefit with this information. And until next time, have a great day.